So, mostly in Ghana, when a person is quiet and a person is by himself or herself, the person, you don't usually see the person in social gatherings. We usually term the person as you are anti-so. Oh, yeah, anti-so. But do we really know who an antisocial person is? Or do we understand it when we say the person has an antisocial personality? Let's talk about it today. My name is Obapeni Awojemfua. Today we are talking about antisocial personality disorder. Sometimes it is called sociopathy. So this is a condition where a person has no regard for right or wrong, and they have no regard for people's rights and feelings as well. These people, they are very, very manipulative, they are aggressive, they are reckless, and they have no regard for the law. So they have criminal mindsets. And the shocking or the amazing part of it all is that they show no remorse when they are even caught in their criminal activities. Let's look at what causes antisocial personality disorder or ASPD. So, number one is genetics. Personality forms during childhood. According to research, the main causes are not well known, but research believes or shows that genetics or family inheritance can be a factor which causes ASPD. Another one is also childhood traumas. See, a lot happens to a person during childhood. That is why I keep asking what happened to you growing up, because it is what has made you who you are today. And childhood traumas such as neglect, abuse, or anything that traumatizes you as a child or that emotionally makes you imbalance all triggers these disorders. If you found yourself in a family where there were violence and the family was unstable, it can result in ASPD. Well, according to research, men are at a higher risk in contracting this disorder than women. Let's look at the symptoms. They have impulsive behaviors. They are unable to make stable decisions. They are incapable of making decisions or planning ahead. They are aggressive. They have this hostile character in them. And it is so frequent. Their hostility and then aggression. They are also very, very deceitful. And in their deceit, they manipulate for their personal gain. Their deceitfulness, their manipulation, it's all for their personal gains. So they are very reckless. Very, very reckless. As I said earlier, they have these tendencies or these criminal acts in them. So they break the laws all the time. And then when caught, they show no remorse about their actions. They feel proud of their criminal activities or their criminal mindset because they are not even remorseful when you catch them. It is believed that adults who show these ASPD conditions actually had the symptoms of conduct disorder before age 15. But because as parents, we look at our children and we are like, oh, as for this child, he's stubborn. Some people will say, oh, when they grow, they will change. It is actually the conduct disorder that results in antisocial personality disorder. They also isolate themselves. Probably the name antisocial because of all their criminal mindset and criminal activities and the aggressions and the deceitfulness and all that. They are mostly alone. For their effects, they have a short lifespan because of their recklessness. There's a highly possibility that they will die early or they die early. And they engage in substance use, or substance abuse. They are always seen in and out of prison because of their fraudulent activities, their criminal mindsets, their criminal activities. Unfortunately, they are unable to sustain a long-term relationship. Who would want to be with a criminal? Who would want to be with a deceitful person or a manipulative person? So they are unable to sustain a relationship. They are seen as failures in life because they can't even hold a job. They can't hold down a job. They don't even have ambitions. They are unable to complete their education because of all the symptoms and anything that makes them. They end up having disorders such as depression or anxiety. For the treatment, well, it can be a lifelong challenging condition. And the unfortunate part of it all is that the people who are suffering from this condition don't even accept that they have a problem in the first place, to want to seek help. Know that mostly they seek help, but not related to ASPD. They seek help because of the anxiety symptoms they are feeling, or the depression that they are feeling, or the outburst of anger that they usually experiences. That makes them think that they need help in that regard or in that line. Not that they feel that they have a disorder. Their treatment depends on the severity of the condition and the willingness of the person to seek treatment of the condition. Psychotherapy is one way of treating this condition, also known as talk therapy. It helps in having that conversation to identify what really is the underlying cause of the anxiety or the depression or the anger outburst that the person is talking about. And this talk therapy will help the person to understand who he is or who she is, and then how to manage or have control over himself or herself. There are no approved medication by the Food and Drugs Authority for this condition, but mostly their physicians give them medications that are able to control their depression and then their anxiety. So depression medication or anxiety medications is mostly recommended for these people. And then the last one is the coping skills or the coping mechanism. This one is mostly done for the family or the loved ones to help you understand the person's condition and then how to cope or how to live with them, how to manage them in a way that will not cause a lot of problems in your home or in the environment which you find yourselves. I hope this also helps for today. Thank you so much for always watching. I'll see you some other time. Bye.